Okay, we are now live.
Hi guys, welcome back to another session with Fresh Dental Shadowing. Today we have Dr. Halabi here, and I'll give the floor to you.
You're giving it to me now, huh?
Yes.
Okay, so my name's Dr. Andre Halabi. Thank you guys for having me. So basically, this is going to be a pretty casual presentation. And if you guys have any questions, you can ask Mona, and then she'll just relay them to me. So that's me. And so what will be discussed today? So I'll tell you guys what I did leading up to getting into dental school. I'll tell you what school was like for me and how to succeed, graduating and finding a job, work-life balance, and then at the end, I'll show you guys some cases that I've been doing over the past year and a half. So I'm pretty fresh. I'm a pretty fresh dentist. I graduated from USC, Herman Osler School of Dentistry, and I graduated in 2019. As an undergraduate, I went to the University of California, Santa Cruz, and I got my biology degree there. And I was also on the tennis team there. So that was one thing I did that I felt really helped me get into school. And after I went to Santa Cruz, I went to graduate school at UCLA, and I got a Master of Public Health there with a concentration in epidemiology. So there's a lot of factors that go for you guys to go to school, to be a dentist. And some of those factors, you think about location, the clinical training, reputation, and also fun, because you need a balance. Otherwise, you're going to get burnt out, and you don't want that. For me, I didn't have a scholarship, and I didn't do any residencies after school. I just went straight to work after I started applying. A lot of dentists, they believe that you need that. You should go to residency, but for me, I'm totally fine without doing that. So it's really how you feel by the time you're done with school. For me, it's not absolutely necessary. It's how you feel. That's what's important. So my specialty, I'm not a specialist. I'm a general dentist. I like to do a wide range of procedures. So in my day-to-day, I do crowns, fillings, implants, not as much, but I still do them, extractions, root canals, and Invisalign. So that's pretty much your bread and butter. If I just do one procedure all day, every day, I'm going to get kind of bored. So that's why I like being a general dentist, but everyone is different. If you think you like root canals, then you can be an endodontist. If you want to be an orthodontist, you'll figure that all out in school. They'll teach you every single specialty, and whatever you like, you can go into that after you're done. But just so you know, as a general dentist, you can still do all that, but you're held to the same standard as a specialist. So I practice in Huntington Beach, California. Some deciding factors for where I practice and my job is location, autonomy, like what I can and can't do. Pay is also important. Obviously, you don't want to get underpaid, because when you just exit school, they'll know that, and they'll try to kind of sometimes lowball you. Don't let them do that, because you worked hard, you deserve to get paid for what you do. And there's corporate versus private practice. For me, I've worked both actually, but now my main work is a corporation. I'm a corporate dentist, and every corporation is different. So pretty much some benefits of my job in this corporation, I'm free to do what I want, but they do like to see numbers, and I've heard this, that sometimes they put pressure on you to sometimes diagnose more, things like that. But in my job, I have never felt anything like that. No pressure to upsell, and I'm actually pretty happy there. But I have also worked in some private practices, and it's also good. But sometimes you're working with someone else, and they're the boss, and they'll kind of run the show, which is also okay. Are there any important factors to look for when applying for accepting jobs? Yes. You want to see what the clinic looks like, what kind of insurances the clinic accepts. There's different kinds of insurances because it depends. For example, if you work for somewhere that only accepts, there's PPO, at least in California, I'm not sure how it goes on the East Coast, but there's, we have Medi-Cal, Denti-Cal for a kind of low income, which is fine. It feels nice to help people like that. But if you work in a place that has, accepts many insurances, it's going to be kind of stressful because you're going to be seeing more patients. I've worked in some offices that have accepted a lot of insurances, and I've had to see way more patients than I have to do in my main job. And it did get kind of stressful. So this is mainly for you guys because you guys, I believe you're not in dental school yet, but the most important part is just to get into any school you can and just go from there. I don't have any really dental experience. I wasn't an assistant. Some people do that. I did shadow a dentist. That was good, but I felt pretty useless there because he was just kind of doing his thing, and I felt weird. It's hard to ask questions when they're so focused, but it was a good experience. Don't put too much pressure on yourself, of course. Just don't do that. You're going to get burnt out. I think it's really important to sometimes just relax. I know there's a lot of sometimes stress. You're like, oh, I need to get into school. But if you just do your best, you can do it. If I can do it, you can do it. I didn't have the best grades in school, maybe around a 3.3, 3.4. So shadow a dentist, I guess, which is kind of what you're doing right now. Study for the DAT. And I believe I used Chad's videos and DAT Destroyer. Those are really good for me. And I got a pretty decent score just from studying those things. Apply as early as you can because they will check your application earlier and you'll get an earlier interview, so they'll have more time to accept you. Relax during interviews. Most of the time, they just want to get to know you. They just ask me, like for me, they just ask about what I like to do in my free time and just act like it's pretty friendly. It wasn't too bad. And then once you get accepted into some schools, you can make an educated choice of which school you want to go to. Which one did you like the most? How are they clinically? You can do some research. There's different types of learning in schools. Some, they do group learning. It's called PBL, where you're kind of in a group and then it's not the traditional lecture. Like where I went, we did group learning. I actually like that because lectures, I don't know, sometimes it's kind of boring for me, but everyone has a different way of learning. So it's also something to think about. So you got into dental school and now you just have to get through it. Once you're in, you're good to go. All you have to do, you just got to focus. There's going to be lots of studying. You're going to be in the sim lab during the first 1 or 2 years. You're going to be practicing on the plastic teeth. Take that seriously because it's going to make it much easier to drill into the real patient's teeth. You won't be as nervous about doing that. Volunteer on missions to do more dental work, get as much experience as you can. I keep saying this, don't get burnt out. I'm serious about that. Do other things besides dentistry because you can easily get sucked into this. Even sometimes I do with work. I take it so seriously sometimes, and it just trying to there's ups and downs, trying not to let it get to you. Treat your patients well in school and they'll be more reliable because sometimes you get cancellations. Just be nice to them and you'll be able to get a lot of work done. Get as much experience in the clinic. That's important. So when you're out there and you're applying to jobs, you can tell them, what kind of stuff you did in school. That's one of the most important things they ask. What can you do? Every single job, they ask me, what procedures can you do? Okay, apply to GPR if you want, or specialty, or you can just take the boards in school and go to work right after. That is up to you. So after you're done with dental school, you get your license and you start applying to jobs. You can look at Craigslist, or there's a website called Indeed. I got mine on Craigslist, which I thought was super old school. I was surprised, but this job is actually really good. So Craigslist can be a solid place to look for a job. And when you interview for a job as an associate, try to learn as much about the clinic as possible before you commit. Sometimes, like for a corporation, they'll have like a long written contract. So before you sign that contract, make sure you find a dentist that has experience with these things. Read over the contract, have someone else read it over with you, for you. I'll do it for you if you want. If you still have my email and it comes to that, I can do that. I have no problem doing that. In some places, they don't really have a contract. They just tell you, hey, this is what your pay is going to be like. This is what it's going to be like. That's also good too. Preferably no contract. That's the best way. For me, I had a contract. Some people, they want to start their own practice right after school, and you can do that too. If you're ready and you're financially available to do that, I say go for it. I don't know how it is on the East Coast. Maybe it's even better, because in California it's super saturated. But yeah, there's probably more opportunity where you guys are at. You have to take some CE courses to renew your license. And if you want to get better at some things that you didn't do as much in school, you can do that too, like root canals, extraction, implants, Invisalign. Because in school, you mostly do fillings and crowns, and then, root canals, extractions, you do way less of those. So a lot of people, I feel like they're kind of worried about doing those, but you just got to go for it. Implants, I didn't even learn in school. I had to do that on my own. Same with Invisalign. So with regards to working as an associate, the more procedures you can do, the easier life and your job will be. Because with patients, if something happens, for example, if they need a root canal because of something you did, you'll be able to do that right then and there and get them out of pain. Otherwise, they get kind of mad, and it gets kind of stressful when they're like, oh, you messed me up. Now I need this root canal. But if you can kind of do it right then and there, because that, I guarantee you, that's going to happen to you multiple times. It happens to everyone. Work is up and down like any other job. Things are not always perfect, and I want to stress that, because as a dentist, you always think that everything is going to be perfect, and it's not. You in school, you'll think, oh, I need to make this perfect. And in school, they teach you the ideal way of doing things. In real life, you'll find that that's not, sometimes you can't get that, no matter how hard you try. So it's up and down. And if work is getting to be too much, you can cut down days. As an associate, it's pretty easy to do. But when you're a business owner, you have a little bit more commitment. Travel and relax, of course. Okay, so working as an associate. Some days can be crazy busy, others not as much. Communication and explanation is important when treatment planning for patients. If they understand why they need what they need, you can be the best dentist in the world, but if you can't tell them why they need it and show them with pictures and x-rays, they won't accept your treatment. So it's really important. Fillings and crowns are the norm. Sometimes I do root canals, extractions, and implants. If you don't feel comfortable doing something, refer to a specialist. Do the best you can for the patient and be honest to them so you don't have any regrets. Even working in a corporation, I don't feel like I said, I need to upsell or anything like that. Things will happen. It's how you handle them, which matters. Yeah, sometimes, for example, in a root canal, look at the picture on the lower left lower right, I'm sorry, of this slide, at the very end of one of the roots, I broke a file in there. You just let the patient know that happened and it's going to happen. But most of the time it's fine. You have to tell them though, or else they can try to sue you. Okay. On the left side, those are just, I did a big bridge there. She was really happy with that. Those kind of cases, it feels good because you work really hard. They're not happy with their smile. After it's gratifying. This job, sometimes it's really nice when you can help someone like that. Here's another one. This girl, her front 2 teeth, she was crying about them. It's crazy what 2 crowns on the right side, what that can do. And she's really happy with that too. And on the bottom, I did the bottom 6 crowns for this guy. His teeth were super ground down, just from the wear and tear over time. So I did his lower 6 crowns and they look really good. He was happy with that. I also do some implants. So implants are a good thing to learn. It's kind of scary at first because that's one thing I never did in school. So I took one course. I never even put an implant in a live patient until I did it myself at my work. So even if you're scared, I did it, you can do it also. It's just a little overview on implants. You want to avoid critical structures. For example, here, I don't know if you guys can see my cursor, but this bubble here, this is the sinus. You want to put the implant here in the bone. You don't want it to go too far into the sinus. So you'll learn. They'll show you in school all these the anatomy. Like for example, in this pano, here in the lower, this little line here, this is the nerve. And you definitely want to avoid that when doing the implants. For example, you just put it, maybe this long, just to make sure it doesn't go in that nerve space. So basically, as long as you avoid those structures, the critical structures, you should be good. And you just get used to that, you will get better. The more you do, you'll get better. Here's some more implants I did. This is one I did immediately, actually. You pull a tooth, make sure that you have enough bone, and then you can put the implant immediately. But first start with just putting implants in bone where the tooth has been extracted already. Just take it step by step because that's a little bit more advanced. Okay, that's pretty short, but thank you guys. Are there any questions for me? This is my Instagram. I don't have a YouTube, but that's my email. You can always email me whenever you want. Don't be shy. And that's Fresh Dental Shadowing Instagram.
Okay, thank you so much. So we're going to start off with some questions from the YouTube live chat. One question was, what is the minimum amount of salary corporate dentists can ask for starting off?
Okay, so that depends on where you are. In California, I think it's a little bit lower. But if you're on the East Coast, okay, for me, I get a base pay or a percentage of collection, whichever one is higher over the average of the month. I get a base pay of $650 per day. And if I do more, obviously I get more. So I would ask for something like that. On the East Coast, it could be even higher, the percentage. You need to look that up. It could be 30, it could range to 30 to 35%. And that's pretty good as a corporate dentist.
If there's anything you could change about your dental journey, what would it be?
Oh man, let me think about that one. If there's anything I would change about my dental journey. Nothing. I'm actually pretty happy with where I am right now. I just make sure in school that you do your best. Like take it seriously from day one. It'll make your life way easier when you start working. Like with procedures, just do as many as you can. It's really important. And as long as you do your best, you won't have any regrets. You won't think, oh, I should have done this. I should have done that.
Another question was, what would you recommend somebody who's taking a gap year?
Oh, it's okay. You don't have to go straight to being into dental school. I didn't do that. I guess I kind of took a gap year, but I got my master's in public health in the meantime, which took about 2 years. But if you're not going to school, you can do something such as you can become a dental assistant. You know, you don't have, I don't think you need a license for that. Just a regular DA. You can do that for the year and also study for whatever you need to study to get into school, the DAT. Or you can take extra courses to boost your GPA. Or you can just travel and relax. It's whatever you do to make yourself happy. As long as your stuff is good enough to get in, it's fine.
Did you work at all during dental school, and do you have any tips on financing dental school and how to go about that?
Okay. I didn't work at all during dental school. I just focused on that because you're pretty busy. So for financing, they have, financing programs at loan. They give you loans, and then you have to start paying it back after. So there's that, but there's also the military. You can do like that where they pay for all your school, but the thing is you got to pay them back in years. For example, 4 years of school, they paid for that. You got to be in there, work for them for 4 years. For me, that's way too much commitment for me. I actually applied to that and I got accepted, but I couldn't do it. I don't like the idea of being, you can do, you're under them. You have to do what they want. And the pay, in my opinion, it's not as good as what I'm doing now. So whoever asked me if I went into the military, I think I would have regretted that. So that's something I'm glad I didn't do specifically. But my dad was in the military and he loved it. But it's not for me, too much commitment.
So since you work in like the corporate world, would you also have to relocate if they told you to?
No, not at all. It's just this one office. So I work for this Filipino guy. He's a dentist. He owns around 40 offices. Most of them are in California, some in Arizona. But this is his one office in Orange County. It's in Huntington Beach. But he just wants me there. I just work there every day in that Huntington Beach office. I don't have to go to like a different office or anything like that. You don't have to really relocate. And same thing for all my other jobs that I've had. They never were like, oh, go here. Like you'll just be in that office. So you can like move there and work. And there's so many job opportunities, by the way. There's more than you think there are. So don't think like, oh my God, I'm not going to get a job. Because I see job opportunities popping up in my email every day.
Do you have any other recommendations of looking or finding a job as a dentist other than Craigslist and Indeed?
Let me think. There's gotta be. My friend, he's like, sometimes he cold calls offices, but I don't know if that's as effective. Yeah, there's Craigslist, there's Indeed. I know there's other websites that you can look at. Whoever asked that, you can send me your email and let me look into that. What do you guys have on the East Coast? Is there something different that you can look at? Like for jobs, is there like a certain site?
No, we have we have Craigslist and that too.
Okay.
Or what is I feel like there's one solely for like getting, but I can't remember off the top, but it's something online, yeah.
I know there's some more. Those aren't the only two things, but those are the only two things that I have used specifically. But there's definitely more opportunities than that. I would have to look into that.
So you mentioned earlier that you had a 3.3 GPA. What do you think set you apart in your application as a dental student?
So I kind of use tennis as an excuse. If they asked me about my GPA, I was like, I was playing tennis like 5 hours every day for the team. Like, okay, fine. But you can say, there's always reasons. Just be like, hey, maybe I had a bad year. Like, it's fine. I still, I got accepted into a good amount of schools, even with a 3.3. As long as you have above a 3.0, I think you should be good. As long as you have just say you have some other things like, oh, you were a dental assistant or any other extracurriculars. As long as you show up and you do your best at the interview and you just tell them straight up what's going on, it should be fine.
Did tennis help at all with your manual dexterity, or how else did you train your hand-eye coordination?
I think that helped a lot. I think tennis really helped me with everything, like handling pressure. Like if something comes up, like I don't blame it on other people. It's mostly, it's mostly me. You just have to accept that. But as far as my hands and my dexterity, I think it helped a lot. But if you don't have to be like a natural, just practice in the sim lab a lot and you'll get better at prepping the teeth. First I was like kind of clumsy, but you just get better at it. And now it's like, honestly, it's getting kind of boring. It's so repetitive, but it's fun to help the people. That's my favorite part about the job. But as far as the procedures go, once you do it over and over again, it's like clockwork.
Why did you decide to go to USC Dental School, and what set that apart from the other schools you applied to?
So I went there because the prestige. Like I went there because of name, and I already lived in LA for a while and I wanted to stay there. I did get into some other schools on the East Coast. Arizona, I got into there, but I didn't really want to relocate because all my friends, my family, they're all here in California and the weather's super nice. Yeah, your guys' weather is crazy over there. It can get cold there sometimes. I'm not used to that. I like the warm, the heat, the sun. Tennis, that was also a factor, so I can keep playing here. What else? Yeah, it was a really good school, but it was really expensive. That's something to consider. It was so expensive, but if you work hard, you can pay off the debt.
Since we're talking about tuition, and you mentioned earlier as well that your dad was in the military. Somebody asked, what are your thoughts on the HPSP program?
Yeah, that's the one I originally applied to. Okay. That is a good idea because they'll pay for all your school, everything. And I believe sometimes they pay you on top of that. Like maybe they give you some sort of stipend, like $2,000 a month or something to use on top of that. But like I said, you need to pay back in years so they can kind of put you where they want to put you. And so my friend, he is in the military. He did the scholarship, and he's stoked because he doesn't have a penny of loans, but I don't think he's doing much right now with regards to clinical stuff, prepping. I think he's on a boat right now, just doing exams. So it's just different. You won't get as good at procedures. You're not going to get to do like crazy things, at least from his experience. That's what he's telling me. So if you get out there and you're like a corporate dentist or a private practice, you work for someone else, you're going to do way more things and get better at them, and you're going to make more money. So it's a balance, But if it's too much, the loans, yeah, you can try to do the military thing.
Do you think you'll ever open up a private practice and get away from corporate dentistry?
For me, right now, I don't think so, because I don't like I have commitment problems with those kind of things. Because if I want to get away from dentistry, I can do that as a corporate dentist. I can stop this whenever I want. But if I have my own private practice, then I'm kind of stuck. But a lot of people, they want to be their own boss, which I totally respect too. In this corporate job, I kind of am because I'm the only dentist there. And I don't really talk to the higher ups that much, to be honest. I just kind of do my own thing here. So it really depends on how you want to do it. It's not a bad idea to own your own practice or to be a corporate dentist. You can kind of start being a corporate dentist or work for someone else in a private practice, and you can see how you like it. You don't have to open up right away.
Do you have any top 3 criteria when deciding the best dental school?
Yeah. yeah, do your research. The clinical is the most important for me, you know, because some dental schools I hear you don't do as many procedures, and that's going to make a big difference when you get a job and how comfortable you're feeling doing those procedures. So that was my number one, actually. And I heard that USC had really good, you know, a good clinical program. They had a program, a few actually in that school, where you can go to, there's Skid Row here, where there's a big homeless population. You can do crazy things, like a ton of extractions there. You can do root canals there, because a lot of people there, they need that. So you can volunteer there and do things like that. So maybe when you apply to school, see if they have something like that, where you can do more. You have an opportunity to do more clinical things. So that's my top one. Another one, what kind of learning? Is it PBL, like the group-based learning, or is it lecture-based? Some people, they like one or the other. And for number 3, location. What's the weather like? Yeah, it's all a balance. And tuition. That's important. Don't get me wrong. So maybe top 4.
How did you go about your personal statement, if you remember at all? And do you have any tips for writing it?
Okay, I just wrote it all about tennis. I made my whole application about tennis because that was the strongest point of it. So whatever you can make it about, you can make it about dentistry. You can make it about whatever what your hobby is and how it correlates with dentistry. Like I correlated my tennis playing with, like I equated that to dentistry. Like being a tennis player, you need to handle pressure. You need to put long hours into it. You need to be focused, determined, all those things. You can, as long as you can connect it to dentistry, you're good. To whatever you do. For me, it was tennis. For you, it can be, whatever you like to do. Or something that happened in your life.
Sorry, I was muted. How was the school environment? Was it competitive at all, or were students willing to help each other?
In USC, we're all pretty tight. I actually really liked it there. It was nice. I kind of miss that actually about school. You wake up and you see the people every day. You see them and you're like, hey, what's up? How's your day going? And it was pretty helpful there. I didn't feel, there's always that little bit competitive vibe there. That's how it is. Like, oh, how many procedures did you do? But it's fine. Like in the end of the day, everyone was trying to help each other. I liked it. I really liked how it was at USC. I'm sure people are normally they're kind of like that. I feel like if you're nice and helpful, like people will be the same to you. Try to just make as many friends. Just be nice. You'll be fine.
What do you think is the most challenging about your profession now? Because you mentioned you had some commitment issues to dentistry, starting your own private practice. So maybe what would you do if not dentistry?
If I wasn't a dentist, something with tennis. Maybe I'd be like a hitting partner for someone, or like a coach, or I'd coach a team, maybe do that. But being a dentist is actually really fun. But like I said, there are ups and downs in the job because things don't always go your way. Like sometimes something can happen during a procedure. Like for example, in a root canal, if you're going to break a file in the tooth and then you have to tell the patient it's not a good feeling. But just don't take that home with you. A lot of people, they take these things to heart way too much. I'm one of those people, especially before, but you learn to kind of just accept those things that happen. Just make sure you plan your treatment carefully and you're on top of it. So when things do happen, that you're ready to handle the complications.
Since you're so interested in tennis, why did you not decide to do sports dentistry?
Oh, sports dentistry. Because I don't know if there's do it for a team or something. Do it for people on a team.
Yeah. That
would be cool actually. But the thing is, there's only I don't know how many people on a team. That would actually be really cool. But you need like volume of patience. I mean, I still get some people that play sports, and I can make them night guards and stuff, and people who break their teeth because of sports. So that's cool. You can like identify with the patients about that. Yeah, oh yeah, I didn't break a tooth playing tennis. It's not that much contact, but that is interesting that you say that.
Can you go into more detail about SimLab?
Okay, so in the SimLab, you start. It is kind of overwhelming at first because they want you to do like these perfect preps, like drilling in the teeth, the hole you create. They want those to be perfect, and they grade you on that. Like, how far did you extend in the tooth? How deep did you go? And they like have these specific measurements. So it's kind of overwhelming at first, and it's crazy. But once you do it over and over again, you get more confidence. Sometimes I was with people in there from like 8 a.m. to 12 a.m. Like literally all day, we were just prepping teeth. But that's what you got to do. That's a commitment you need. Otherwise, if you just kind of half-ass it the whole time, you'll be behind. So just take it seriously there, because that's where you learn how to do all these things. But you'll be in there for a while. You like some days you'll be there all day, just all day. But you get used to it.
Would you say that was the hardest part about dental school?
Yeah, I think SimLab was harder than the real deal. It's because it's the first time you're always learning something new. Like one day you're learning how to cut like a crown. The next day you're learning how to do a root canal. It's always something new. But once you get into the clinic, it starts becoming the same thing every time. And now my job it's another root canal. It's another crown. It's the same thing. So I would say the SimLab it was tough, especially at first. Some people they're like crying the first day. It's just funny, but yeah, it's good. Good learning.
I'm sorry. Can you go over your work-life balance and how to avoid a burnout?
Yeah, because that's important. So first, I used to work Monday through Saturday. It's 6 days a week because I just wanted to get as much experience as I could. But like you said, over time, I got a little bit burnt out. You just cut down the days and do your own things, especially on the weekends. Don't take work home with you on the weekends. Don't try not to think about what happened. Unless they're good things, you can be like, yeah, that was sick. Like I did this and it was really fun. So that's cool. It can like kind of reignite the spark. Go hiking, do sports, or just hang out with friends. That's what I do. I usually like to hang out with my friends every weekend because it gets my mind off of that, and it's good to have fun. You need the balance. It's really important.
Do you have any interview tips for people who may be more prone to be anxious and nervous?
But do I have any tips for people? Wait, sorry.
Do you have any interview tips?
For people who are more anxious?
Yeah, or just in general.
Yeah, maybe, just be honest with them. I was nervous in the beginning of my interviews, especially the first one. They asked you questions, but they weren't really out there sometimes they did grill me a little bit, but just tell them the truth and tell them about your experiences. Don't lie to them. It should be fine. And just say whatever you have to say from your heart. Why you want to be a dentist, if they ask you that. It's fine. Even if you're anxious, you'll be fine. I was nervous too. Sometimes I get nervous at work, even though I've done these procedures millions of times by now. But once you start, it's totally fine. You got it.
Why did you choose dentistry, if you want to elaborate?
I chose it because I wanted to do something in health. If not tennis, I tried to go pro first in tennis, and I wasn't good enough. So I was like, okay, I need to do something else now, because I was playing all the time, focusing on that. And then I thought, okay, I want to do something with healthcare, because my sister, she was a nurse and she said she liked that. But so I just kind of looked into those kind of things, and dentistry, it just looked interesting to me. It wasn't my dream from like when I was a kid. It was kind of a last minute decision, but now I'm really happy that I chose to be a dentist. It's an amazing job because you can always help people.
So when did that come to you? Was that like your senior year of undergrad, or
it came to me after? It was after. Like I already graduated, and I applied to public health. That was just a filler. I didn't really know what I wanted to do at that point. And that's when I started, thinking, okay, maybe I'll try to be a dentist. And so it's never too late. There was a guy in my class, he was 45, I believe, and he's a successful dentist now. It's never too late. There's something I was going to say. Yeah, it's never too late, really. And sometimes you'll think, oh, maybe this isn't for me. You'll think that. Sometimes I wanted to quit when I was in school. Like in the beginning, I was like, actually, I don't even know why I did all this. Why did I do that? But if you go through with it, it's going to be fine. Even if you think it's not for you, you can make it work.
How did you manage to stick with it, since like it wasn't necessarily a burning passion for you since like your undergrad life, and you kind of came to dentistry a little bit later? What helped you like stick with it afterwards?
So what helped me stick with it is well, in the first 2 years, I just kind of pushed through it. And then once you start seeing patients in the clinic, that's where, I was like, wow, I'm actually happy I did this, because it's something else to be able to help someone, like, for example, take them out of pain, and by pulling their tooth or like doing a root canal. There's something really special that in the way that you can do that. Not everyone can do that. You're a specialist of oral health. It's like it's a big thing, and it's like humbling sometimes that you can do that. And that's the main thing. When a patient's happy at work with the work that I did for them, that's my favorite thing. It's not even doing the procedures anymore.
Another question was, how was the implant course, and was it annoying going back into education? And would you have preferred learning that during dental school?
No, I didn't mind. I actually liked it because it was in Las Vegas. So that's always a fun area to learn things, because you can go out at night and have fun, and then go back to the course and learn. I thought it was really good. I practiced putting implants in a typodont, like a model, before I put it in a patient. I just put one in. I think dentists would say you're crazy for doing that, for just only practicing in a typodont, but everyone does it their own way. Once you put it in the patient, you'll know how to do it, even though it's scary at first. The courses are good, for implants especially.
What happens if the implant is rejected by the patient? Has that happened to you before?
It hasn't happened to me yet, thankfully. I hope that never. It's gonna happen one day. It will happen. When it does happen, I'm just gonna back it out and then bone graft and try again. But it's gonna suck explaining that to the patient. You have to, though. If you see it as failing, you just gotta take it back out. You can either put a bigger one in. You have options. But it hasn't happened yet, thankfully. But like I said, you'll have options. Put another one in, or put some bone in after you take it out, and wait another 4 months. You have to wait for the bone to heal up before you put another one in there sometimes. Just make sure, you follow the protocols of putting an implant, and that you have good bone, and the chance of it failing is pretty low. And I like the chances, so that's why I like doing them.
How do you deal with difficult patients?
Yeah, that's tough. That's a really good question. You just gotta be patient. Like don't So there's at some point, I've had some difficult patients where I had to straight up tell them, I don't think I feel comfortable treating you anymore. You're going to have to do that. If they're just busting, treating you bad all the time, you got to just put your foot down and say, hey, I don't think it's working out anymore between us. It's like a relationship, I guess. But I would say 95% of the patients have been really good. There's some kind of difficult, but it's okay. Just try to deal with it. But if they get to the point where you feel like they're trying to run all over you, don't let them do that. You can't let them do that. It's too stressful. Sometimes you gotta just let them go.
How much time do you spend with things not necessarily concerning doing procedures? So let's say legal matters and insurance and all that stuff.
Like legal matters, with regard to malpractice.
Not necessarily. I guess yes. I've shadowed before in a dentist office where people have tried to take things to court, even though it's not necessarily malpractice, it's just dissatisfaction of the patient.
So with that, I feel like I haven't had that yet, but then again, I haven't been practicing for that long. But I feel like it's that is really a communication thing. You need to communicate everything to the patient. And even I have had patients, get mad at me for something, but you just gotta take care of it and take care of them. It's okay. They say you will get sued. I probably will at some point, but communication and just be nice to them, the chances it's low. I think it's low. But I haven't had to spend any time actually with legal things. Not yet, at least. Thankfully. Knock on wood. Maybe one day, but not yet.
I'll knock on wood for you.
Thank you.
Did you change your study habits at all from undergrad and the graduate program to dental school?
No, I kept it kind of the same with regard to studying for a test. I just kind of, the way I do it, I like to read all the notes maybe a week before, and just the week leading up, I just keep reading the notes over and over. But in the sim lab, you got to actually practice on the teeth. That's something different. You're not really thinking. You're kind of, that's where you're working with your hands. That I took more seriously than the actual studying. But make sure it's a balance. You want to make sure you study hard, because the more knowledge you have about these things, patients ask you questions all the time. And when you have the good answers, they respect that and they trust you more. So if you don't study and you're I don't know, then just make sure you know as much as you can. But I read the notes. You'll learn how to take the test better and better. Just whatever works for you, do that.
Did you have a mentor at all during dental school and coming out of dental school?
I did. It was actually the dentist I shadowed. He's still if I have any problems, complicated cases, I send them to him, the x-rays, and he always tells me, maybe you can do this, do that. And sometimes I even text my friends. You always have friends. You can text them too. They're all going to be dentists. Just see what they think about a case. In school, I wouldn't say I had a specific mentor, but if I needed help, I had people I could ask. You'll have people you can ask to help you out, and even after school too, because you'll meet people. You'll always have someone.
Can you go over the difficulty level of board exams and how stressful it is, and how does it compare to the DAT, for example?
It's worse. Everyone was freaking out about that test. So there's boards in California. There's boards part 1, the one you study for, and then boards part 2. Those aren't bad. You can just study for those. That's not a big deal. The actual dental boards, where you're working on the patient, doing a filling or root canal on the tooth, and they're grading you on that, that's kind of stressful. But with the whole pandemic thing, I don't really know if things change now. Maybe it's more more easy. I'm not really sure with that. For me, I did a filling on my brother, and I was pretty nervous. And also you have to do a deep cleaning on a patient. Finding the patient is actually the most stressful part. They don't give you the patients. You got to find them yourself. And it's kind of, that's stressful, because if you don't have the patient, how are you going to take the test? If you don't take the test, how are you going to get your license? So I would say that was one of the most stressful parts of all of school. But once you get over that, it's so nice. You get your license, you can just work. It's like you're free.
How did you go about finding a patient?
So I brought my brother in. I got kind of lucky. We took x-rays on him, and he had a cavity that I could do. So I kind of lucked out there. But you can ask your friends, be like, hey, you're going to get this filling for free. It's going to be really good because it's a test. So it's going to be a good filling, and just ask around. And then also you can use your patients in school. I used one of my patients from school for the deep cleaning portion. But it's kind of scary because you need to find someone reliable. Because if they don't show up on that day, like I heard stories about that happening to some of my colleagues, and I felt for them. It sucked. But I mean, in the end, they all passed. It was all fine. Because sometimes there's extra patients too.
So what do you do if your patient doesn't show up? What happens?
You have to act. In USC, there was a board like, oh, my patient canceled. Like, does anyone have an extra patient? Or someone was sending emails, does anyone have an extra patient for like a filling that I can borrow? And someone always responded like, oh, I have one here, take mine. Because sometimes if you pass the first filling, like you can, or if your patient has more cavities, they want to get that work done for free. So that's why they'll do it with you also.
How many people quit dental school because of grades or realizing it's too hard?
In my class, to be honest, there was like 5. There's 144 of us, and I think about 5 quit. One guy, it was crazy. He quit the first week, but he was super like stoked about it. But then after the first week, he quit. That was kind of crazy, but I didn't think it was for me. I think I would have regretted quitting. It would be a big regret, even though I'm not like, it's not like my favorite thing I do every day. I still like it. You don't have to have a burning passion. It's okay.
Are dental school lectures a lot different from regular college lectures?
No, it's kind of the same. It's the same. Like if it's a PowerPoint, they just read the things and then you kind of look. It's the same. Not much different. Just more material. I would say that's a big difference.
Was it overwhelming at all to adjust to the new amount of material?
Sometimes it was, but if you have good time management, you should be good. You can handle it. It is stressful sometimes, but they don't want you to quit. They don't want you to fail out. No one wants that. They want to keep you in there, and so you can be a good dentist.
Could you mention your undergrad major again?
Yeah, it was just biology.
It's just biology.
It's just I did, chemistry, organic chemistry, physics, all those prereqs. It like encompassed that degree. It was just a biology degree.
Would you recommend any other courses that are not included in the pre-dental prereqs that would have been beneficial for dental school?
No. Just take the prereqs. I didn't take any other courses. Anything, if your GPA is on the lower side, take more science classes so you can boost up your science GPA. That's the only reason I would take more courses.
Another question, this is the last one. Do you have any counselors in dental school to guide you through the whole process of specialization and when to take board exams?
Definitely. You will have those resources and they'll help you out with specialization, the boards. You have in school we had like leaders, group practice leaders, and you can email them anytime. They'll help you out with things like that. It's really helpful there. It's good.
Okay, awesome. Those are all the questions. We're at almost 8 now, so that's it. The quiz will be sent out into the group me, and you can also access it through our Instagram. Yeah.
If there's anything else you guys need, you can just email me, and I always respond, or message me on Instagram. Whatever you guys need to do, I'll help. I'll do whatever I can to help.
Okay, awesome. Thank you so much for hosting a session with us. And
you're welcome. Thanks for